going to be speaking about some of the things that we're doing globally around stigma. It's been really, really inspiring to hear today about what you're doing locally in Italy. I'm very thankful that you've invited us here to talk about our global message and how we're trying to amplify more work around stigma and challenging. Just a little bit about Alzheimer's Disease International, just in case you haven't heard much about us. I know Mrs. Salvini spoke about us this morning. We're a global federation of all Alzheimer associations. We have 100 members now. We have official relations with the United Nations and with the World Health Organization, so we work very closely to advocate on a global level for our member associations. We have very, very big associations like the Alzheimer Association in the US. We have medium-sized ones like here in Italy, and we have teeny, teeny, tiny ones in places that are run by volunteers like in Lesotho. So we have a huge range of different associations. But our main purpose really is to ensure that we keep dementia on the global, as a global health priority, and that we facilitate research. That means research into a cure, but also research into care, because we've heard today how important it is to have care in the absence of a disease-modifying drug. And also about breaking down stigma and challenging stigma on a global level. So this is just a bit more about how we support some of our associations and how we are the sort of global voice for advocating to break down stigma. So something that ADI does is we are sort of the trusted source for data and information about the situation of dementia globally. And you'll see here, this is an infographic that we developed. We know now that currently there are 50 million people that are living with dementia globally. And that's going to triple by 2050. There's going to be 152 million people. And we know that every 3 seconds, someone develops dementia. That's a staggering statistic when you think about it. And if we just let that sink in for a minute, you can see that this is a problem that we really need to pay attention to. We also know that it's a $1 trillion disease, and in only about 11 years, it's going to double to 2 trillion. So not only is it something that we need to pay attention to, but it's something that governments need to pay attention to and plan for the costs of the care of people that will be developing dementia. Okay, today we're here to talk about stigma and what we can do about it. And I'm going to talk a little bit about what ADI is doing about stigma. But I thought it would be interesting just to sort of contextualize it and to think about, we all know that stigma has been around forever, hasn't it? In fact, we see that in 500 BC, the Greeks were using stigma. The word was to brand someone, to set them apart. We know that it was described in the 60s as discrediting someone. And we know that it has marked them with undesirable characteristics. So this is it's a word to set them apart from the rest of us. It's labeling people. It's making them, we're us, they're them. And this starts to develop this feeling of fear. We've already heard this today. This feeling of fear, repulsion, disgust, things that we don't understand, we're afraid of. And in the person that is labeled, the person who is stigmatized, there are feelings of shame and embarrassment and humiliation. We need to think about this when we use specific language. There's huge feelings of loss and discrimination, and we've heard really good examples today about that in different contexts. And it becomes a cycle. So this lack of understanding, this lack of awareness creates and generates a real fear. And this is reinforced by the language that we use. And then it ends up with exclusion of people who are living with dementia and their carers and their feelings of isolation. So what can we do to break that cycle? How can we bridge that gap? So today I'm going to tell you a little bit about what ADI is doing. We've heard what's happening locally, so I'm going to tell you some of the work that we're doing on a global level. I'm going to talk about three things. I'm going to talk about the World Alzheimer's Month and some of the activities that are happening around that. The report that Mrs. Salvini talked about this earlier today about the survey that we did, the global survey, I'll tell you a little bit about that. And then I'm going to talk about some of the active research that ADI is doing. And these are some of the projects that we are actively involved in that are looking at better understanding more about dementia so we can make better policy recommendations to government and get better care for people and break down some of that stigma. Yes, okay, so before anything, I think it's so important to say that we need to listen to the voice of people that are living with dementia and their carers. And Francesca you started exactly as we should have with the video of Luigi, his name is Luigi, talking about his experience. It is so important that we understand people's lived experience with dementia and the experience of their carer. It was a perfect way to introduce us into this conference. At ADI, we have in our executive board, we have a place for a person living with dementia, and you'll see, you can't really see it very well, but Kate Swayfer, who is someone you might have heard of before, she is the chief executive for Dementia Alliance International. This is an organization of people that are living with dementia, only people that are living with dementia, and they are advocates. And they go around to different conferences, they take part in different research, and they bring that voice of the person living with dementia into the work. And she is on our board. It's very important to have her included and have that voice in all of the decisions that we make. We include people with dementia in our conferences, just as you have here, in all the research that we're doing. A couple of the photos there are from some of the webinars and some of the projects that we're involved in. So this is very important in terms of listening to that voice. And I'm really, really pleased that you started the whole conference with that. And I could understand it because the ladies in the booth were translating for me. So first, just talking a little bit about World Alzheimer's Month. This is whole month, September, we're in the middle of it now, dedicated to anything around raising awareness around Alzheimer's and dementia. It's a global phenomenon. Our members, our 100 members take part in this, but also other people take part. There's activities that range from memory walks to conferences like this to appearances on television and radio. And we have 21st of September is actually World Alzheimer's Day, and there's a conference that's happening on that day, I could see, which is fantastic. So there's a lot of activities centered around that day, and that's been going since 1994, which is brilliant. So this year, the theme for World Alzheimer's Month is Let's Talk About Dementia. And you can see these are some of the different things that we've developed at ADI that people can have access to. So you can use this on social media. You can use it on Facebook and Twitter and LinkedIn if you do any of those things. But there are other materials. And this is all available on our website. You can see the website there. It's also other materials that are translated into English and French and Spanish. I'm sorry, it's not in Italian. I'll have to talk to our CEO. Our CEO is Italian, so I'll have a word with her. But all these are available free to download, and you can use them yourself. There's also a bulletin that you can use. So if you want to hand out information to people, it tells you about dementia, it tells you about some of the activities, it gives you the infographic that I showed you at the beginning that shows how many people are living with dementia and estimates for how it's going to grow. And this enables you then to have information that you can share with people and start to change their minds. So this is a global phenomenon, and these are just some examples of what's happening. You'll find these on our website. I know there was this flash mob. I wish I'd known about the flash mob, because maybe we need to incorporate more flash mobs, because I don't think that those are happening yet. But I loved that idea. So you'll see in New Zealand, the whole month of September, people are being encouraged to wear purple, because that's the color of the New Zealand Alzheimer Association. My friend Elizabeth in Kenya is having a few memory walks that she's doing. In Russia, they're having some more of their memory cafes and opening it up and encouraging more people to take part. And in Indonesia, they're doing some intergenerational risk reduction workshops, which is really interesting. They have this dance that they call the Poko Poko, and they all get together and do this dance. It's a dance they've all done their whole lives at weddings and things like this. But they did a study that actually looked at people having that physical contact, doing the, listening to the music and doing the dance, and they measured their cognitive ability afterwards, and they could see that it actually stimulated their cognitive abilities. So it's, that physical activity in terms of risk reduction is a good thing. These are some past examples of some of the activities that have happened. You can see in South America and in Europe. I can't even see Namibia in Southern Africa. And also people have, in Qatar and in Jordan, they've lit up buildings, which has been quite effective because it's a very visual thing. Then people start to ask, why is the building purple? And then it's an opportunity for people to talk about it. You could light up your basilica here. I mean, that would be quite effective, wouldn't it? So the next thing that we do, and the next thing that Alzheimer's Disease International is very well known for, are our World Alzheimer reports. And these are very trusted resources through the years that have looked at different aspects of dementia. We've looked at things like the cost of dementia. We've looked at women in dementia. We've looked at the prevalence and incidence of dementia. Different subjects that we've looked at. This year, the subject is going to be stigma. We're often asked at ADI, how do you know what you are doing is effective? How can you measure? And when our new CEO came in, Paola Barberino, when she arrived, she was asked that question a lot. And she said, we've got this baseline that we did in 2012 that looked at people's knowledge and levels of stigma. But it was a very small sample, and we needed something bigger. So we linked in with London School of Economics to do a bigger survey, a global survey. And we were stunned that we had almost 70,000 people respond to that survey. Mario helped us by translating the survey instrument into Italian, and we had quite a few Italians that responded to that survey. And it was really, it's given us an opportunity then to look at a global level at what people's attitudes are to dementia. And we've been analyzing these data over the last few months, and we are going to then, that will be the heart of the World Alzheimer Report this year, and it will then be sort of padded out and with some expert essays and case studies so that we can really delve in more deeply into programs that are looking at people with dementia, issues of stigma in different countries, and things that are working in different countries. And again, Mario's given us one of those expert essays, so it's really exciting to have this real global view of what's happening. And this is going to be launched on the 21st of September on World Alzheimer's Day. So I would encourage you, if you're not on our mailing list, please join our mailing list so that you can get a copy, or look on social media. We will be sending it out, and it will also be on our website. So I would love to tell you all of the wonderful tidbits that I have from that survey, but I think I would get in big trouble from everyone at ADI if I revealed too much too soon. So what I can tell you, though, are general themes that came out of the survey. So while we were doing this, when we developed the survey, we looked at 4 key groups. We looked at people living with dementia, we looked at carers of people living with dementia, we looked at health and social care workers, and we also looked at the general public. So we had 4 groups that we focused on. And then we took the data when it came in and we separated it into 3 different areas. We looked at knowledge around dementia, we looked at attitudes around dementia, and then we looked at how these influenced behavior. Okay, I'm going to try to read these. I can't, I'm sort of in between. I'm going to put my glasses on, sorry. So I'm going to read some of the themes to you now. So, let's see. Do people think that they will develop dementia in their lifetime? And is there anything we can do about it? Is dementia a normal part of aging? Are people with dementia dangerous? I've got to get better glasses. Do doctors and nurses ignore people with dementia? Do we take the opinions of people with dementia seriously? Can people with dementia continue with intimate relationships? Should people with dementia hide their condition? And if you had it, would you? Are there adequate community services for people with dementia and their carers? Are there competent physicians for the diagnosis and treatment of dementia? So these are some of the themes that came out of the survey. And it's been really interesting to see how these compare on a global level. They're different at a regional level, they're different at a country level, and they're different by economic level. So we looked at World Bank categories and we looked at World Health Organization categories. So we divided them by regions, but also by economies. So I'm really excited for it to come out, and I hope you enjoy it when you see it, because we've worked really hard on it, and make sure you give yourself time. It's going to be a big report. Okay, quickly, I'm just going to go through a few more things and just talk about some of the research that we're doing at ADI. And I'm going to just talk about 2 projects. One is the STRIDE project, and the other is some of the work we did around dementia research webinars. And I've already talked about the World Alzheimer Report. This is a list of some of the research that we are involved in at ADI. We are asked constantly to get involved. Generally, we get involved only when we feel that there's going to be an impact for our members, especially in low and middle income countries, because we want to make sure to share and spread the knowledge. So I'm just going to talk briefly about this project, which is the STRIDE project. It stands for Strengthening Responses to Dementia in Developing Countries. The goal of STRIDE is really about enabling people with dementia to live better and to ensure that they and their carers don't shoulder the economic burden of their care. But really it's about developing research capacity. So it's ensuring that we enable people that are living in low and middle income countries to know how to gather data and information, because data is so essential if you're going to do any sort of advocacy with your government, or advocacy to amplify a message and change people's hearts and minds. You need data, you need proof. That infographic that I showed you at the beginning that showed you how many people have dementia and that every 3 seconds someone develops it, it's very persuasive. So we need to help people know how they can do that, then how they can take their data and demonstrate the evidence that they need to change opinions. And so that they can then use it to, and also so that we can understand the impact of dementia in different cultural and economic and political countries' aspects. So this is across 7 different countries, And it's a unique collaboration with the London School of Economics and other universities. You can see it's in Mexico, Brazil, South Africa, Kenya, India, and Indonesia, and you can't really see it, but Jamaica is in there as well. And we've got a combination of researchers who are working on the project, as well as our civil service, our associations. And so what the researchers do is they might gather the data, but the civil society and the associations are able to really make sense of that data and connect connect the researchers to people living with dementia and their carers so they can make it more tangible. And it's been amazing to see how they have worked together and how they're really starting to change the way the work packages are working. The project has different work packages looking at different types of research. There are 10 different work packages. One of the work packages is focused on stigma. And we're looking all across those 7 countries. We've done phase 1, where we've done a couple of focus groups in different parts of each of those countries, looking at understanding people's knowledge and attitudes to dementia. And then we're going to move into phase 2, which will develop a toolkit, an intervention toolkit that will be sort of an anti-stigma toolkit. And then we're going to use that toolkit and evaluate it in 2 separate countries. We're going to test it out in Brazil and in Kenya, really drill down and see how that works, and then evaluate the use of that, tweak it and make changes, and then it's going to be made available to the public on our website. All of the materials that will be developed with Stride, all of the research materials, any of the templates will be available on the Stride website for other countries and other people to use. ADI's role in Stride is taking all of the data from all the different work packages and then fitting it together to make policy recommendations. 2 of those countries that we're working in have national dementia plans, but the rest do not. And so what we are going to do is pull all those data together and make recommendations on what needs to be done in order to have a national dementia plan, which then leads us to have more dementia plans as it's called for in the WHO Global Action Plan on Dementia. One last thing, I'm just going to talk quickly about research webinars that we did this past year. We wanted to create an opportunity for the public and people living with dementia and carers to actually have an opportunity to talk to professionals to understand what is going on in dementia research. What kind of clinical trials are out there? What do you have to do to be involved in a clinical trial? If you get a diagnosis in your country, how do you take part? Do you go through your GP? Do you have to go through your Alzheimer Association? Where do you even start? Are you afraid of clinical trials? How can we start to open up that conversation and talk about it? So we had a series of webinars. One was looking at just sort of myth-busting and talking about dementia research. The other one was looking at the gaps between what's available in low and middle-income countries in terms of research and clinical trials as opposed to high-income countries. And the last one looked at some of the failed trials. And we talked about this a little bit earlier about pharmaceutical trials and the stigma around that. We had Biogen and Roche come in and talk about their experience with their 2 drugs that have just failed. They've pulled out of those. And the idea was, is there hope? Do we continue with trials? I mean, tell us, do we have any hope left? It was a very interesting webinar where basically, unequivocally, they all said, we have to keep trying. And a failed trial doesn't mean that it was a failure. We always learn something every time we do one of these trials. So they're all recorded, and if you want to watch them, they are on our website, so they're freely available. So the whole idea is there is a way to begin to break down stigma. And it's about awareness and understanding, doing more of what we're doing today. This is from our 2012 World Alzheimer Report. Even then we were talking about this, and we're still talking about it today. There's so much work that we have to do. It's all about that. It's all about having less negative attitude to people, to understanding more. Then you have more empathy within your society. You reduce that fear and you reduce the stigma. And that's how you break the cycle. You break the cycle with more awareness, which encourages more understanding and people being more accepting and feeling part of society. So this is our call to action. It's time for us to really break down that stigma and treating people with dementia with the respect and the dignity that they deserve. Thank you.